So we're back to Margaret Louey. Second time lucky.
Okay, take two. Last one. Thank you for the presenters, for the organisers for letting us discuss how our public-private partnership was able to expedite the development and registration of generic pediatric Dolutegravir dispersible tablet for low-middle income countries. Oh yeah, I have no conflicts to disclose. You've seen a lot of these numbers already, but what I wanted to say was a lack of accessible, effective, child-friendly formulations leads to lower adherence, inadequate viral suppression, and poor health outcomes in children living with HIV. As a contributor to this is the delay between adult and pediatric formulation development, followed by the generic product development after that. You know a lot about DTG already. It was originally approved in 2013 as a tablet for adults and adolescents greater than 12 years and 40 kilograms. In 2018, when we initiated our partnership, WHO had updated their guidances to recommend DTG as first-line treatments for adults, adolescents, and children where the approved dosing was available. ViiV Healthcare was developing a pediatric DTG dispersible tablet for greater than 4 weeks and 3 kilograms, but generic development had not yet begun. In our partnership, the objectives were to expedite the development and registration of the generic DTG 10 milligram scored dispersible tablet for low-middle income countries. Our partners included ViiV Healthcare, who were conducting the clinical studies to demonstrate safety and efficacy in the child population with HIV. They provided a tech package as well as clinical supplies for the BE studies and ongoing technical and regulatory support. CHI, with funding from Unitaid, provided a financial incentive to accelerate generic product development. We developed a novel regulatory strategy, provided ongoing technical support, as well as negotiated a global price for the pediatric Dolutegravir product of $4.50 per bottle, which is a 75% cost reduction from the existing standard of care. Mylan and McLeod's were our generic partners, and they committed to accelerating their product development for the generic product, as well as openly sharing the product data that they were generating within our partnership. The key timelines are addressed here. Oops, sorry. The key timelines are here. In 2018, we initiated the partnership. ViiV conducted their technical transfer to the generic products, and generic product development commenced. 2019, ViiV completed their clinical studies and submitted to the FDA. In 2020, ViiV obtained their FDA approval in June and commenced their commercialization of their Dolutegravir dispersible product. Mylan and McLeod's completed their product development and bioequivalent studies and submitted to the FDA. In November of 2020, Mylan was able to obtain their FDA tentative approval. In March of 2021, McLeod's obtained their tentative approval, and both generic companies completed their validation and commenced commercialization of the generic Dolutegravir product in low-middle income countries. The graph here shows the time gap between the innovator product and the first generic product. Oh, sorry. The graph shows the time gap between the innovator product and the first generic product for pediatric ARV medications. You can see that several of these historical products, it takes several years and even more than a decade in some cases, compared to the Dolutegravir product, where we were able to reduce that time gap from years to months. Mylan was able to obtain their tentative approval 5 months after the ViiV approval. Macleod's obtained theirs 9 months after the ViiV approval. Sorry, I don't know. One more. Okay. Okay. All right. In summary, you will see that our public-private partnership was significantly able to accelerate the development registration of the pediatric Dolutegravir product. And we were able to launch the pediatric Dolutegravir product at an affordable and sustainable price, enabling greater access in children with HIV living in low middle income countries. Okay, one more. Thank you. So next steps are that we are continuing with the country-level registrations, as well as starting product introduction in various countries. And that this approach of using a public-private partnership is a viable model for future development of prioritized pediatric medications. And the acknowledgements are that with the funding from Unitaid, we're able to conduct our work through CHI. I also need to acknowledge our work, our colleagues at ViiV, Viatris, and Macleod's. Thank you.